Hello and welcome, ladies and gentlemen, to a new edition of the Daily Debate. In tonight's show, we're going to be focusing on the health file. This is in light of 46 medical convoys that will be taking over from Cairo to a lot of the border governorates, a lot of the underprivileged villages and countrysides all over Egypt, starting from December 2nd until December 10th. We're going to be focusing on the Decent Life Initiative and the health file within this initiative, and we're joined here in the studio tonight by Dr. Islam Anan, the lecturer of the Health Policy and Health Economics at Ain Shams University. Dr. Anan, thank you very much for joining us.
Thank you for having me, and hello, Mr. Hadi.
Thank you very much, sir. Ladies and gentlemen, before we start our conversation and discussion with Dr. Anan, let's check out this report regarding the 46 free medical convoys from December 2nd to the 10th, going to different underprivileged villages and border governorates. Let's check out this report and we'll be right back.
Ministry of Health launches 46 free medical convoys in the governorates from today until December 10th. Ministry of Health and Population announced the launch of 46 free medical convoys in governorates of the Republic starting from the 2nd until the 10th of December as part of the presidential initiative Decent Life. The medical convoys are directed to the border governorates and remote villages with a commitment to take all precautionary measures to prevent the spread of coronavirus. The convoys include all medical specialties, including internal medicine, children, nose and ear bone surgery, teeth, heart, dermatology, and childbirth, family planning services, in addition to radiology and medical analysis services, in addition to a pharmacy that is available in all medicines and cases that need surgical operations are transferred to hospitals affiliated with the ministry. 3 medical convoys will be launched on the 2nd and 3rd of December in Arabia Governorate, Abu Ghalib in Manshiyat Al-Qanatir neighborhood in Giza Governorate, and the Triangles Medical Center in Hadaiq Hilwan in Al-Masra district in Cairo Governorate. 7 medical convoys will be launched on December 3rd and 4th in the critical areas in Sohag Governorate, Kafr al-Sheikh Governorate, Qalyubiyya Governorate, Asyut and Fayoum Governorates. Egypt is set to start second stage of Decent Life Initiative, which comprises series of countryside-focused national infrastructure projects by January 2023. Minister of Local Development Hisham Amna said the second stage of the presidential scheme is planned to cover 1,670 villages countrywide to provide services for some 20 million citizens. The Decent Life National Project was initiated experimentally in 2019 by President Fattah al-Sisi, and its first phase was officially launched in July 2021. The initiative aims to improve standard of living, infrastructure and basic services, including healthcare, across the countryside, covering 4,658 villages across the country, which are home to 58% of Egypt's 103 million population. The enormous volume of work needed to develop the selected villages required initiative to be divided into 3 stages with a total estimated budget of 700 billion Egyptian pounds. The first stage of the initiative, that services 28 million citizens in 1,477 villages, is expected to be concluded by December. Initially planned to be completed by 30th of June 2022, the program was delayed by shortage of raw materials and equipment from abroad owing to the current global circumstances. Some 23,000 projects have started within the scheme's first stage, with the implementation rate hitting over 70%. The initiative, as a great and unique program, does not exist in any other country, as it aims to achieve social justice among all Egyptian people. The investments in the presidential program are expected to reach more than 1 trillion Egyptian pounds. The 3-stage initiative will change the shape of Egyptian countryside, improve the lives of citizens, and make all basic services available.
Welcome back, ladies and gentlemen, starting off our discussion with Dr. Anan. Now, Doctor, we are talking about the 46 free medical convoys, and this is part of the Decent Life initiative. Now, the whole initiative was launched and started being implemented in July 2021. Now we're ending the first phase of it, and the second phase will be starting in January 2023. Now, let's say that these 46 convoys are considered some sort of a conclusion for the first phase. Before we start talking about the actual convoys, how would you assess the health file within the Decent Life initiative that is really looking at almost 1,000 villages so far in the first phase?
Yeah, so that's a good point to start with, which is our vision and focus for health. So if we are looking on the file of healthcare since 2018, we can see it drifts and change, a big change in terms of even financials. So we were talking about a budget allocated for healthcare from the Ministry of Finance of around 70 billion Egyptian pounds, but we are talking since 2018 till now around an average of 200 billion Egyptian pounds. So there's a leap in the financial resources and for as well the vision itself. So since 2018 and the launch of the presidential initiatives, we focused more on what's called a person-centric vision of healthcare. So countries all over the world, they focus on one of three centricities, either a system-centric healthcare, which is just focusing on having a good data, a good system, a good governance, and a good digitalization, or it's a patient-centric, where we are looking at the benchmark of diseases and whether we are above or below the benchmark, or a person-centric, which is a public health concern, focusing that we don't need any patients. So it's either a patient-centric and I'm treating the patients, or it's better, it's a person-centric and I don't want any person to be a patient. So because of the vision, we started in Egypt, and the presidential initiative were focusing on having a better life for Egyptian citizens. And that's why we've seen screening programs, we've seen early detection for diseases, we've seen 100 Healthy Lives initiative, and we've seen a Decent Life initiative, which is focusing mainly on the health as a product, so improving health.
So
and
it's a person-centric?
it is a person-centric. Currently, we are working on enhancing, of course, the system, so we can finish the system centricity and the patient centricity while aiming for the goal of person centricity at 2030, inshallah. So basically, for Decent Life initiative, it's how to reach, as you mentioned in the introduction, how to reach the underprivileged citizen who can actually find the logistics of seeking the insurance and healthcare a bit complicated. Maybe they are not aware of the paperwork and logistics. Maybe they are not aware of whether they got symptoms or not, whether they need to seek any medical consultation. So it's better to reach them door by door and tell them, okay, I'm at your doorstep, just tell me if you need any help, any support, and then I can make the differential diagnosis. And the convoys are actually equipped from the beginning of the journey, which is diagnosis, having lab and diagnostic tests and diagnostic tools, till diagnosis, differential diagnosis, whether the patient got any non-communicable disease or a communicable disease. And then, if needed, there is a tertiary care. For example, they need a nephrologist, they need someone who can track their diabetes profile. And if there is, for example, something which is need a complex intervention or a complex imaging, they can be sent to the insurance coverage entity they belong to. Because, you know, Egyptians are actually with the HIO, Health Insurance Organization insurance, or they are with the on-state fund insurance. So that's the convoys. It provide what is called a health integrated services from the diagnosis part till the follow-up and treatment management.
So these 46 free medical convoys, they're basically maybe part of the patient-centric system, and they're actually dealing with the patients, starting from, as you've mentioned, the diagnosis to the treatment and the following up of the treatment. Now, the first phase really targets about almost 25 million Egyptian citizens. Now, how far and how aware are those 25 million that have been subjected to the implementation of the first phase of the Decent Life Initiative with its healthcare? How aware are they of going to the doctor, doing regular checkups, trying to deal with any sort of symptoms or suspicions of a disease or illness before it actually deteriorates?
That's actually another good point, because health education, it's a hot topic. Because sometimes, even during COVID, you've seen, for example, you do a lot of access programs where you actually put the treatment, vaccines, and everything inside the health care service providing facilities, but you end up with limited flow from the patients, what we called the reach. So in terms of having a good access and a good reach, you need a very good health education and health awareness. Sometimes people are not aware that these symptoms are a hospital driver symptom. You need a medical consultation. Sometimes they are not aware that's a communicable disease. Maybe you can infect someone else. You need to isolate yourself. So these both things, whether the health education and awareness, are two different things. We begin with the awareness first and then education. And it's actually basically built in as well in the convoys, because you are spreading awareness through brochures, through consultation with the physician, how to deal with your daily routine. It's pure patient-centric, but we are trying as well, if the patient is free of disease, that how can you improve your health? For example, you do have with the convoy itself the same initiative of the dwarfism, stunting, and obesity, which is going to be targeting the children as well as adults. So you are focusing on trying to improve the quality of life and the lifestyle.
Yes.
And this is a very important point, because we are facing a high prevalence of diabetes in Egypt. By 2050, we'll be one of the top 5 countries with the number of diabetic patients. So we need to decrease as much possible obesity, for example, at children level. And we need as well to manage the lifestyle and the eating habits. That's why you will find that all the presidential initiatives are connected together. So you got a decent life. It's connected with the stunting and obesity initiative. It's as well associated with the lifestyle modification initiative. So you are trying to build on the health of the citizens and trying to diagnose, but same time early detect and trying to prevent the upcoming diseases.
Yes. About the 46 medical convoys, now it is the winter season here in Egypt. Now, is there a significance for the timing of these convoys? Were they supposed to be sent out earlier? Could they be regularly sent, a certain number of convoys for every changing of the season, for instance? What is the significance and the main goal and the main achievement that these 46 convoys want to achieve?
So basically, because we are approaching the flu and RSV season, we have a surge right now in many countries around the world from RSV perspective. It's important to have your convoys at periodic quarters per year. So you got at the beginning of the season, you are beginning of the spring season, so you are actually spreading through the year. If you are entering the winter season, it's very important to have the convoys covering as well the communicable diseases. So for example, if there's any patient approaching the convoy with any symptoms of a communicable disease, talking about flu, common cold, COVID, or RSV, they can be actually handled very easily, because they are not only handling chronic diseases or diagnosing chronic diseases, they will be handling as well acute or infectious diseases. Currently, it's good that you mentioned the winter. The RSV virus is spreading. We have it circulating all over the governments, all over the world actually. And it's good that we are focusing now on the preventive measures for the RSV. It's a respiratory virus. It's exactly the same preventive measures of COVID. We got acquainted now with the preventive measures of COVID. So it's same story, but we need to as well educate parents how to manage their children, because in winter season and all respiratory diseases, early management and good management at early stage is the key for successful remedy and successful remission. It can be actually went out in 1 week, but if it's, for example, with a bad treatment and there is no follow-up, In the first week, it can last for 3 weeks or 4 weeks.
Dr. Anan, now, the first phase of the Decent Life Initiative was in July 2019. Now, that's almost 3 years now.
Yeah.
And in those 3 years, the whole world went through a coronavirus pandemic, and then we heard of the monkeypox, and then cholera, and the seasonal flu, and the respiratory diseases. Now, in terms of trying to implement such an initiative with a main concern with the health aspect of this initiative, did these pandemics, these diseases, did they hinder or slow down the implementation, the health implementation within the Decent Life Initiative, or did we learn something about ourselves? Did we learn more about our health system, the system-centric at least, qualities and characteristics of our initiative?
So talking about, for example, 2020 and the beginning of COVID, we've learned that the main key of having an efficient healthcare system is agility. We don't have an agile healthcare system. We've seen systems with rigid and robust structure on the shell outside, but deep inside they are suffering a lot from long logistics, which is countries were ranked at the top 5 countries in the healthcare, something like Italy, for example. However, we've learned a lot that being agile in terms of taking fast decisions, being agile in changing our health policies from partial lockdown to, for example, designated hospitals for isolation, for example, moving physicians from a governorate to another. This agile system and the fast decisions managed that we can actually go through the wave very easily. And another thing we've learned, how can we manage chronic diseases through the pandemic? Because at 2020 we had the initiatives for chronic diseases, and we needed that these patients continue taking their treatments. Sustainability of treatment is the key for preventing complications, and the complications is the #1 cause of death in the chronic diseases. So, for example, they've done the safety passage. The safety passage is actually a plan that you can move patients inside hospitals to take their treatments outside of the isolation hospitals. They can seek their medical consultation, and instead of taking 1 month's medication, they can take 6 months, so they don't need to travel a lot to their hospital or their dispensing pharmacies. Another point which was actually very important is to designate specific hospital for isolation and COVID, and another hospitals only for senior citizens and geriatrics. So you are making sure that people above 65, they are not contacting or approaching any COVID cases or any hospital with COVID cases. So we managed, maybe it slowed down a little bit the initiatives, of course, and for example, the 100 healthy lives, but in terms of targets, we managed to achieve the targets. So if we're looking at figures, because figures will be a good judge here, we managed to finish the hepatitis C initiative earlier. We managed to treat more than 2 million patients. We managed to screen 25 million women for the breast cancer initiative. For the children hearing aid and health, they've managed to screen 3 million children. Every year, even through the pandemic, the stunting and obesity and anemic children presidential initiative, they managed to screen around from 8 to 9 millions every year. So maybe it was 10 at 2019, but at 2020 it was 8. So there's 2 million difference. Then because, the lockdown, there's no many children going to school. It was 9 in 2021, and then return now the target will be 10 millions again. So maybe there is a slowdown a little bit, but we manage at least to keep the targets of the presidential initiatives.
Dr. Anan, now we are kind of done with the first phase of the Decent Life Initiative. The second phase will start in January, which is next month. Now, what are the main targets? I mean, the Decent Life Initiative is a big one that includes different sectors within the government, but with a focus on the health sector. Now, is it just about targeting more villages and more people and millions more Egyptian citizens, or are we trying to develop the system-centric and the patient-centric and the person-centric? Are we done with certain centrics and then trying to achieve different centrics, or is it just more of the same that what we've done and achieved so far in the first phase of the Decent Life Initiative?
Okay, so we are moving in many directions. So, for example, we have the system, patient, and person-centric. Egypt is trying to move in the three centricities together, but the aim is person-centric. The main purpose of the convoys is to reach what's called equity in healthcare. So you need to ensure that all citizens, all Egyptians, are actually getting the same healthcare at any governorate, at any village, regardless they are actually in remote or rural areas or in urban or main cities. So that's the main purpose, to reach them all. And second one is to have a good database of the Egyptians, because you are not going to be able to sustain a good healthcare without data, without an informed decision-making process. And we need to build a good data about the Egyptian people health, the diseases, for example, the epidemiology of chronic diseases, the prevalence, the incidence, the mortality rate, the remission. So we are actually treating patients with fairness and achieving equity, which is, as per the vision, we do have two main pillars in the vision, the equity and the efficiency. And the efficiency will come next after we are having the data.
Yes.
So these are the two main pillars we are trying to seek. Treating all Egyptians by fairness and equity, and equitable access and reach. And secondly, to have efficiency, which is a data-driven thing, that after we collect database, we can actually make another initiatives, enroll them in actually insurance system, because you will have the governorates being enrolled in the new insurance, universal health insurance system, governorate after governorate. So you need this database, and at least to make the capacity building and the planning of your resources, especially if you are going to the high density population governorates in the near future, next year.
Yes. Well, now that you've mentioned the health insurance system, now the Decent Life Initiative targets the villages, more than 4,000 villages across the whole of Egypt, but the health insurance system covers all of Egypt, including the highly densely and sort of developed governorates. Now, where, I mean, do they both have some sort of a common ground? Do they intersect in one ways, or are they two different plans trying to cover, or with two different systems? With I mean, the Decent Life Initiative has the three centrics, and at the same time the health insurance system maybe doesn't focus mainly on one, the system-centric, for instance, because it deals with a lot of developed hospitals, and maybe more dealing with the private sector within the health sector.
So let's start with the end here. So by 2031, we should have universal health insurance organization, which is covering all Egyptians. And we do have an Egyptian health authority, which is treating all Egyptians. We have two entities.
Yes.
And that's actually coming from the health governance of separating entities to remove any conflict and increasing efficient governance. So year after year, you are trying to migrate from the old system to the new system. And we are trying as well to integrate between the database of the old system and the database of the new system. So each governorate, the Egyptian Health Authority and the Universal Health Insurance Organization entered, they actually override the systems of the old one. They took the database, they started to treat all patients, and all the old insurance will drop down and they will opt out from it. So all, for example, people from Port Said, they are now covered only by the universal health insurance,
the new
and
system.
not the old system. So even the presidential initiative database, the health insurance organization, the old one, the on-state fund, the old one, all of these are actually cancelled in the governorates that actually have the universal health coverage. And then in the other governorates, you are trying to make what's called a capacity building and a reform plan to integrate the database and the system to the new one. So basically, all of us will be insured under universal health insurance. It's a household-based. So it will be deducted from the salaries, and then you are paying premiums exactly like the private health insurance, but you are taking it in both private or governmental. It will be as a selection from the citizen choice. He can go to a private hospital or go to a governmental hospital, and they should have the same pricing index. So if you need an extra service, maybe there will be a complementary services from another source, but at least we are targeting 80% of Egyptians by 2030 to have this insurance. It's very important because we used to have around 60% out-of-pocket healthcare financing in Egypt. So 60% of the healthcare expenditure is coming from the citizens' pocket. And we need to flip it, we need to make it the reverse. So that's why the aim is to have it all from the government perspective and decrease as much possible the out-of-pocket, because when you decrease the out-of-pocket, you are taking more control in generating health, because you are not leaving it to the private market, to the commercialized market, and it's a faster access if any patient would like to seek emergency, for example, to seek a surgery, a tertiary care, easier than paying. Sometimes people are paying all their savings for a surgery. So that's the main aim again. We'll end up with the same two pillars. Equity, all Egyptians are treated the same in healthcare, and efficiency in terms of actually spending and in terms of savings.
And how long would that sort of transition from the old system to the new health system, how long would this transition period take to be all the new system substituting the old system, especially that if 60% of the financing comes from the citizens' money, there could be some resistance from the private sector who make the biggest profit and benefit the most from these 60%. So how can you overcome any sort of resistance from the private sector and at the same time make it as speedy and as quick as possible, this sort of transitional period?
That's a very simple question in saying it's very complex in terms of answering, but in terms of time plan and timetable, Egypt has put a timetable to finish the transition on migration by 2031. So by 2031, the full migration will end by Cairo. It will be the last government to enter the health insurance insurance system. In terms of resistance, yes, that's correct. You are talking about billions of industry working in private sector. So the first key thing that the government made is to make a new entity which is called a Gahar. It's mainly for accreditation and quality management. This entity is reporting directly to the presidential office, and the role of it is to enroll entities underneath the Egyptian Health Authority and universal coverage. So any private entity that would like to be part of the private insurance, they can do that. They need just to file their requirements and their data to the Gahar, and Gahar will accredit and say, okay, you are up to the standard, you will be underneath the insurance, and patients can still go to the private sector. It's very hard to implement any health insurance without private sector. You need what's called a public-private partnership. However, you need to make it regulated, you need to have standardized quality for the private sector, and you need to regulate what's called a commercial medicine, the sporadic clinics. So any clinic or any private entity will not going to be able to work or operate in the new system after 5 or 6 years if they are operating alone. That's why you will find a lot of lobbying together, a lot of groups are formed, a lot of group hospitals are formed because they are seeking accreditation and going under the insurance. So you need to work with the private sector to decrease actually the resistance, and you need to regulate their quality.
Well, ladies and gentlemen, actually the Ministry of Planning has issued a report regarding the impact of the Decent Life initiative, especially that it has concluded the first phase and now entering the second phase. Let's check out this report and we'll be right back.
The Ministry of Planning and Economic Development issued a midterm report to monitor and evaluate the impact of Decent Life presidential initiative. Decent Life is an initiative launched by President Fattah el-Sisi in 2019 to improve the standard of living and quality of life for the most vulnerable groups in Egypt. Minister of Planning and Economic Development Hala al-Said affirmed the Egyptian state works to reduce development gaps between governorates by focusing on developing villages most in need. She noted that real development occurs at the governorate level and not in a centralized manner, and that each governorate has a different competitive advantage and has different resources. She stressed that justice is one of the goals of the state plan. The Minister of Planning and Economic Development referred to the Quality of Life Index, which is a composite index that aims to create a quantitative tool that helps measure the impact of the efforts undertaken by the state in the field of developing rural communities within the framework of Decent Life Initiative and its implications for the state of sustainable development. Al-Said explained that this is done by comparing performance indicators before and after those efforts. She stressed that among the strategic results of the initiative is the villages of the first stage, the Quality of Life Index improved by about 18% points and the average poverty rate decreased by about 14 points. The first phase of the Decent Life Initiative, which started in July 2019 until the end of 2020, included 143 villages in 46 centers in 11 governorates, and the number of beneficiaries reached 1.8 million. On the appropriations directed to the villages of the first phase, the report indicated that the total appropriations amounted to 5.5 billion Egyptian pounds, directed to 1,901 interventions that included 3.3 billion Egyptian pounds in the fiscal year 2019-2020, 2.2 billion Egyptian pounds in 2020-2021 fiscal year. About assessing the impact of the initiative on localizing the Sustainable Development Goals, the report issued by the Ministry of Planning and Economic Development indicated that for the third goal of the Sustainable Development Goals related to good health and well-being, there is an improvement in the rate of health services coverage by about 24 percentage points. Al-Said confirmed that 255 medical convoys, 1,400 surgeries provisions of 538 prosthetic devices, 5,420 eye operations, provision of 16,500 medical glasses, completed the establishment and development of 12 health units, and 56 health units were to be completed by 2020-2021. As for the fourth goal, the report indicated an improvement in the rate of educational services coverage by about 12 percentage points, as educational services were provided in 3 deprived villages. The development of 7 nurseries was completed. Furthermore, 45 schools were established or developed, including 717 classrooms were completed. 127 schools include 1,493 semesters during 2020-2021. Regarding the sixth goal, sanitation coverage improved by about 46 percentage points. This was achieved through the installation of 706 domestic sewage tanks, 1,559 domestic sewage connections, and water networks of 7 kilometers long. Also, 1,637 household connections have been installed, 49 groundwater wells have been constructed and developed, sewage service connected to 21 villages, and the service will be delivered to 55 villages in 2020-2021. On the eighth goal of the Sustainable Development Goals, the report of the Ministry of Planning and Economic Development indicated that small projects worth 438 million Egyptian pounds and 71,000 job opportunities were provided in the governorates of Asyut, Suhaq, Qina, Qalyubiyya, Minya, Aswan, and Luxor, and Lake New Valley. The report also reviewed the assessment of the impact of Decent Life Initiative on the achievement of the 11th goal of sustainable development in the villages of the initiative. The report indicated that 11,600 houses were improved, 160 kilometers of road were paved, and 11 vet units were established. Nevertheless, the initiative installed 11,000 lighting poles, established and developed 21 youth centers and playgrounds, in addition to establishing and developing 9 social units.
Welcome back, ladies and gentlemen, continuing our discussion with Dr. Anan. Now, The Decent Life Initiative takes care of the Egyptian countryside, over 4,000 villages, but this is not where Egypt is stopping. Egypt also has launched the Decent Life for a Climate Resilient Africa initiative. And you've also mentioned that there is another initiative, the Africa Drug Agency, that was launched about a year and a half ago. Taking our sort of experience with development and initiatives and the health sector in specific, taking it to the rest of the African continent. How big of a step is that? And it will benefit many African states, but how does it also return and benefit us directly or indirectly?
So there's a big purpose from political and economic perspective, and even in terms of neighborhood. So an African country, we actually have been leading healthcare initiatives for a long time. Even we've shared the 100 Healthy Lives initiative with the African continent, and there's been around 200K citizens treated from hepatitis C from the African countries. As you mentioned as well, for a Decent Life initiative, it's very important to promote health in the African continent, because we are the health gate for the African continent. We currently #1 manufacturer of drugs in Africa. We have the oldest plants for drug manufacturing, and Africa is actually a very good market in terms of either directly promoting our medications and our healthcare services, and indirectly by promoting health. And promoting health will enhance in general the gross domestic product of the continent, will enhance in general the infrastructure of health. There's a lot of bonds between the Egyptian governance and the Egyptians and the African countries. And for example, if we are focusing on one thing, on the making our own decisions. In Egypt, we are manufacturing over 90% of our local needs from medications. So we have local manufacturing of more than 90% of our needs. In Africa, it's 5%. So we are in the same continent, and we can have a spillover. We can have a good supply chain with the African countries to make sure that we don't need to make the same crisis of COVID vaccine that happened with Africa all over again. Remember, we took the lead of manufacturing the vaccine and exporting it to the African countries. And so we can easily be the gate. We are ensuring good economic reform and bonds, and we are ensuring as well a good political deed and a good political actually side dealing with the other countries. So I guess migrating and technology transfer, medical transfer of the technology is very important to be shared. We have the know-how. We can actually transfer it to the other African countries, and all of us will benefit from having a better health.
Dr. Anan, now one final question, because we are running out of time, but you're a specialist in health planning and health economics. Now, a lot of people understand that all these health initiatives and all the attention the government is giving to the health sector here in Egypt really focuses on alleviating the quality of life for the Egyptian citizen, but also they don't comprehend the economic impact of such care and efforts within the health sector. So can you explain what are the health and the economic benefits from the healthcare that is being exerted by the government, apart from exporting vaccines and apart from exporting medicines and pharmaceuticals to different African states? But how will this return, taking care of the Egyptian citizens' health, how will this return on the Egyptian economy?
So if we are talking about health economics, we are using health economics in many aspects. I will focus on two very fast. The first of is planning. So if I want to make priorities for my spending in healthcare, how can I actually say that I can allocate this billions of money on hepatitis or on nephrology, kidney transplantation, or for cancer and oncology? So in terms of priority setting, health economics will provide you the burden of any disease. So for example, we've done a burden of disease for diabetes in Egypt, and we found out that having diabetes in Egypt is actually making a burden of 25 billion Egyptian pounds every year. So it's a big burden assessed by the health economics, and it needs tackling. If the disease itself got a little burden or less burden, it will not going to be of focus. I have cancer of high burden, for example. I have diabetes, I have cardiac problems. So in terms of planning the budget, it's very important to have health economics aspects. And it is calculated not only because of what's spent on medications, it's calculated based on the productivity lost. So for example, if someone is not going to his work, I'm losing productivity. Yes. It's what's called absenteeism. He's absent from his work, I'm losing. And this can be reflected during COVID, where we actually were, all of us working from home, and the GDP of the world actually decreased and declined. And second thing is to evaluate the return of investment from any initiative I'm doing. So for example, if I'm doing the 100 healthy lives and treating hepatitis C, I'm getting £4 for every pound I'm spending, because I'm enhancing the longevity of the life years saved. I'm enhancing the quality of life. Yes. I'm enhancing the family health. So in return, indirectly, it will impact the gross domestic product, and it will enhance the productivity. Yes. I guess our time is actually...
Unfortunately, yes.
But we are running out of time.
Yeah, but this has been very informative, because a lot of people don't understand that all the efforts being exerted within the health sector, it's been a common popular demand, the health sector, and obviously along with the educational sector, but a lot of people don't realize how important it is not just to raise the quality of life for the Egyptian citizen, but also there is a huge economic return for the economic status and state of Egypt. Unfortunately, that's all the time we have for this edition of the Daily Debate. Before we go, I'd like to thank my distinguished guest, Dr. Islam Anan, the lecturer of health policy and health economics at Ain Shams University. Dr. Anan, thank you very much for joining us.
Thank you for the invitation. My pleasure.
Pleasure, sir. Ladies and gentlemen, please stay tuned for more coming up on Nile International. I'm Henny Saif. Thank you for joining us.